Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And today we have a very special guest, like I promised yesterday. So here we are, actually today, right, Willie? Today's Hump Day plus one.
Yes.
Hump Day plus one. All right. So we have Natalie here. She is our resident PA at the Aesthetic Center. Okay, she's an expert in all things non-surgical. We're super excited to have her here. You may have seen her in some of our social media in the last month or so. And today we have brought her in to talk about MORPHEUS, which is like the big thing right now. You're probably seeing anywhere from like the Kardashians to anyone you know probably using this right now. So we're super excited about it. So I know you've heard me mention it before, but I wanted to bring an expert. So Natalie's here today.
Hi, I'm Natalie, like the doc said. I'm the PA here with the aesthetics side, and I wanted to talk to you guys a little bit about the MORPHEUS because we have been getting a lot of questions. So MORPHEUS is...
What is that? Tell me.
Yes. So MORPHEUS is fractional radio frequency, and what it does, what that means is basically it uses the radio frequency, thermal injury, as a controlled injury to stimulate collagen and improve tone, texture, elasticity, fine lines of the skin. So
right, but how does it uses RF energy, and then how does it basically deliver the energy?
Okay, so it actually delivers it through fine needles, which we like to call pins.
Right.
Through tips.
Everyone's scared of needles.
Yeah.
All right. How many of these pins are there?
Okay, so we have different pieces for the device. I actually wish I would have brought some, but I didn't. Maybe for the next one, or we can post the tips. But there's Prime, which is 12 little tiny needles, and those are to cover the small areas. So mainly small curved areas over the lip and under the eyes. And then we have the resurfacing tip, which is mainly used for superficial areas. And that one actually has 24 needles that are gonna go into the skin, penetrate, deliver the radio frequency, and then come back out. And then we have the 24 pin, which is also, but you can go a little bit deeper. And then we have the body.
That's the big boy, right?
Yeah, and that one has 40 pins.
So 40 pins for large areas.
Yes.
All right, that's awesome. And they go to different depths, right? So you may have heard of different terms. There's like MORPHEUS, MORPHEUS 8, MORPHEUS body. And that all depends on the number of pins, like Natalie just said, and also how deep the pins go or penetrate the skin, basically. So the 24 pins, what's the depth for that one?
So the 12 pins can actually go up to 4 millimeters deep, and then they emit their radio frequency there. And what I would like to show you is, because we have been getting some patients who are saying, well, is that going to target the fat in my face? Because no one wants to lose fat in their face, right? We're trying to do fillers, fill up face, so we don't want to lose the fat. So it's actually in the face, we wouldn't go deep because there's not much in the forehead and anything. So you are only going to go into the second layer, right, of the skin. We have the epidermis, which is top, and then we have the dermis. So this silicone needle would only go into the dermis and then emit the radio frequency. And then what it causes is, for that, it takes advantage of the inflammatory process, and what it causes is for the body to heal itself and then produce the collagen.
And basically recruit collagen, which then makes the skin look younger, and it decreases, wrinkles or rhytids. Even the fine wrinkles, which are the ones that are tough to get with fillers. And so that's essentially how it's working. But the other thing is actually, you see the drawing here, which she drew very, very nicely. There is actually the top part of the needle is protected by like a silicone sheath, so it's not going to burn your skin, which I think is a key difference with this device, because it's a bit different than, say, a laser, right? When you're doing a laser resurfacing, that's gonna actually heat up the skin from the outside, okay, which is why then the recovery is so much tougher, right? When you do like a true like CO2 laser resurfacing, you can't be in the sun at all. Your skin basically starts to peel off. You can't really be in public. You can't see people, and this is totally different, right?
Exactly.
What's kind of like the downtime for now that we're talking about the 24 pin in the face?
So there's not much downtime. You can come get this done during your lunch break, but you will have a little bit of swelling, maybe a little bit of swelling and redness for the first 1 to 3 days, but it's very rare. Some people don't even get red or swell at all, and if you do, it'll be gone within 3 days. So.
Okay, so you could potentially do it during the lunch break and go back to work.
Exactly.
Right? All right. And do you have to avoid the sun afterwards?
Yes, you do. So you actually have to avoid the sun 2 weeks prior to any Morpheus treatment, and then 2 weeks post-treatment. Just because your skin is fresh, it's healing, we don't want to add any sun to add to any possible hyperpigmentation of your skin.
Okay, but if for those people that are, they've seen the lasers, they've seen that when the skin's all peeling off, looks like your face is falling off. Does that happen with this?
No, you're not gonna get that because they're tiny needles and you're not gonna get that feel at all. Worst case scenario you would get, and this is more so for the larger areas that we're gonna penetrate deeper. That's for the larger areas. You might get the little tiny scabs and those slough off within a couple days.
Great, so yeah, so if you had say it's Wednesday and Friday night you have a big event, you could be doing your Morpheus and you'll be able to go to your event. That wouldn't be an issue.
Actually, your skin would be glowing.
There you go,
So.
even better. All right, so that's a 24 pin. That one goes up to 4 millimeters. That's great for the face. Now, what if you have some skin laxity, say in the belly area, which is pretty common. Sometimes you have it, especially in that lower belly area. You need something with a little bit more power.
Right, so for that one, we're gonna use the body, which is for, again, like the doctor said, for the larger areas, and that one has 40 pins, and that one can go up to 8 millimeters deep and emit the radio frequency.
So when you're going 8 millimeters, do you now maybe hit some fat?
Yes, and that's the good part. Now
Yes.
we get some fat that we don't want on our bodies. So in the abdomen, in the thighs, inner thighs, arms, a lot of patients get it done in these areas to get to target.
So now we're getting down to this layer right here, correct?
Correct.
All right. So that's great. So yeah, exactly. So in the face, you don't want to lose fat, right? That's what happens as we get older. We start to lose fat, and also the skin's not as tight and things start to descend. So we don't want to target fat in the face. But of course, in other areas like the abdomen, thighs, the arms, we do want to get some of that fat to help reduce that and help the skin tighten up and help with that collagen, recruiting of that collagen to then make the skin appear younger with less wrinkles. Okay. All right, so tell us a little bit about the process. So how does it work?
Okay.
Like when you say okay, I'm gonna do it. It sounds great, Natalie. It sounds great, Dr. Earl. I'm gonna do it. What's next?
All right, so of course you can come in for a consult, and we can then analyze your skin and see which areas are concerned to you. So if it's your face or whether it's a part of your body, we'll analyze the skin. We'll come up with choice together on what you would like depending on your wants and needs, and then you would book your appointment, come in that day with fresh clean skin, no sun 2 weeks prior, and we would apply a local anesthetic for about 45 to 60 minutes depending on the location of where you're getting treated. Or we also can offer Pronox, which is laughing gas.
That's great. So we can actually do both, right?
Exactly.
So that's actually very, very important there because if you're going to use a local anesthetic, you do have to make sure you have that on for enough time. So coming in, if you come in late, you only have 15 minutes, that local anesthetic is not going to work. So that needs to be there for at least 30 minutes, but ideally at least 45 minutes. But the cool thing is that we also have that Pronox. What is that?
So
laughing gas.
Laughing gas. I don't know if a lot of you have gotten Pronox or laughing gas before, but if you've gone to the dentist and you've heard of laughing gas, it's basically odorless gas that helps to make you feel comfortable and happy, reduces anxiety.
Calms the jitters.
Yeah, calms the jitters,
Right.
calms the pain, so
Okay.
it's pretty awesome.
Yeah, so have you heard of like sedation dentistry, stuff like that? This is very similar to what they use there. So it is that nitrous oxide. It's something to make you feel extremely comfortable throughout the procedure. And the good news is that it's quick, right? It comes on quick, comes off quick.
Exactly.
And it's something that we're not kind of physically giving you. You kind of use that on themselves, right?
Right.
They have like a little straw, if you will, but the gas, and so you kind of sedate yourself as much as you want.
It's self-administered, so you
Right.
can take as much as you want and you can stop if you ever feel uncomfortable using it. So it's completely self-administered.
Great. And so that means that it's okay. It's okay to drive, correct?
Yes,
Right.
it'll be gone.
So it leaves your body very, very quick. So you don't have to worry necessarily about having to come in with someone else. You can be very comfortable throughout your procedure, and then you're able to drive yourself home. Okay. All right, but is it for everybody?
No, so
Okay.
we have some contraindications. So with a lot of the treatments, obviously, anyone less than 18 years old cannot get this treatment. Pregnancy or anyone nursing, also we do not recommend right now to have that.
Okay.
Anyone with electronic implantable devices, so a defibrillator,
Okay.
any
Pacemakers.
pacemaker,
Got
a glucose monitor that's implanted into you. Anyone with an impaired immune system, so history of cancer, HIV, AIDS, anything like that, just because we don't want to stimulate, an already weak immune system. So
Okay.
any disease activated by heat, and mainly that would be HSV, the herpes zoster virus,
Okay.
active skin diseases. So if you have a lot of acne currently erupting, we're not going to treat that area because we don't want to cause further damage to the skin. And then last but not least, Accutane. Not sure if you're on it, then you would know what I'm talking about. But anyone on Accutane, we can't treat if it has been less than 6 months.
6 months. Okay, so you got to stop that Accutane before this sort of treatment, which is similar for any sort of, basically skin resurfacing, whether it's laser, MORPHEUS, or anything else. And then in terms of the herpes simplex virus, people with a cold sore, I think that's something you need to bring up during the consultation, because sometimes we can give you a medication before the procedure to kind of make sure that that cold sore doesn't want to kind of erupt afterwards, okay? So if you have had cold sores in the past, you definitely want to bring that up during your consultation so that we can then prescribe this medication kind of as a preemptive measure to make sure it doesn't cause like an eruption of further cold sores or anything in the recovery period, okay? All right, so we talked about that. Okay, so they've come in, so now they've come in, they've done the consultation, they're super comfortable, we've done the procedure. So how do they take care of things now?
Okay, so again, you may have tiny little scabs, they will slough off, but immediately after the treatment, we don't want to apply anything to the skin because we do have those pores that are going to be a little bit open, okay, because of those needles going in. So even though they're tiny and you won't be able to see them yourself, it could be a place for bacteria to enter. So you're going to go home with a little small thin film of antibiotic ointment or Aquaphor for the first 3 days. But you can start applying sunblock after 24 hours, and preferably is zinc oxide sunblock.
Okay.
And again, no sun.
2 weeks.
Right, 2 weeks, no sun.
Okay, got it. So, all right. So now, when do you? Okay, first of all, how many treatments are we recommending typically, and when do you start seeing results?
Okay, so you can start seeing results pretty much like I said, a few days after the treatment. You'll start to see your glowing skin, but the actual tightening effect and all that won't be, you could see results again after 1 treatment, but we recommend about 3 to 4 treatments to the affected area, to the area that we're treating, and those are spaced out 4 to 6 weeks. So you come in on May 3rd, and then you would come in June 3rd for your next one, or you could wait 6 weeks, but we really don't want you to wait much longer than that because you want the effects to work.
Right, so I think, for most patients, I think we are, kind of the treatment plan is at least 3 treatments spread out 1 month apart. So that's really can be the expectation. You come in at least 3 times to really have, the maximum result from this procedure. Okay. All right, good. Well, I think we've covered quite a lot. Maybe some questions have been coming in. So if we have first some questions maybe related to this, we'll take those, and then after that, I'm happy to answer any other questions you may have.
Okay, this is about our study center. So, is this an option after a tummy tuck to help tighten anything that's still loose?
Yeah, so it is actually a very, very good option. So let me also kind of put that in terms of surgery, right? So certainly after a tummy tuck, if you have some areas that are still loose and it's not like a large area or anything like that, then the Morpheus body is actually a great option for that because you don't have to go back into the OR, right? There's no more like general anesthesia and preparation and all the downtime and everything else. But it's also something that we can use in conjunction with a lipo procedure, right? So say you're doing your liposuction, you don't have quite that much skin laxity that you're going to require a tummy tuck right away, but you do have some, right? And it's always iffy. We never know exactly how well that skin's going to retract. Well, we can do a couple things to maybe help that along. One is we can add the body tight to the abdomen during the procedure, but then also, especially around that belly button area, that's a notorious area where it's hard for the skin to retract. We can then add that Morpheus body to that as well. And then hopefully prevent some of that umbilical hooding you guys have heard me talk about, where if you have a fixed point in the middle of the abdomen and the skin is loose above it, it tends to just want to kind of hood over and give you that sad belly button type of look that a lot of people don't like. So we can definitely help that along with the Morpheus.
Okay, this is about Morpheus. And say,
Yeah.
I've heard scary things about grid marks being left on face. Can you show before and after, please?
All right, so we're only going to show before and after, but can you address that? I mean, I think it has to do with the settings and the depth.
Yeah, so the higher the energy, because we have different settings on the system, but the higher the energy and the depth, obviously you're going to burn further in. But that's not the intention. If you're actually getting it done by a qualified professional,
Yeah.
then that shouldn't be happening. So you shouldn't have that effect.
Right. So it's
Again.
like we mentioned here. So the only reason that any marking would be permanent if it's the energy is too high and if actually where you're shooting the energy is too superficial to the skin, right? So like I said earlier, it does have the silicone sheath around it, which should be protecting the outer layer of the skin. And so you want to make sure you're at the right settings. If you're going to be only like say in the 1 millimeter range, then those settings gotta have to go down. You can't put high settings at a 1 millimeter range. Now if you're going to go down to 8 millimeters, so you're in the abdomen, then you can crank it up because that way you can affect or kill some of the fat underneath there as well. So it's really all about the experience of using the machine.
Right.
This is for you, Natalie. Do you do lip flips?
Do we do lip fillers?
fillers?
Lip fillers, yes.
Fillers.
We
No,
do.
but it's wrong. It's wrong with it.
Yeah.
We actually do lip to lips, but with Botox, so we can actually place Botox in areas to create a little bit of a lip flip, an inversion of the lip. So we do that, and then we also do lip fillers. So the difference is lip filler would be for some volume, and then lip flip if you already have that volume, but you're kind of, your lips a little bit inverted.
Yeah, and if you want that, you want to lift the lip a bit, I think that's definitely the way to go. I do not recommend the surgical version of that, where you're lifting the lip surgically, because I just think the scar is not great. You have to put a scar just underneath the nose there, and in some people that can get a little bit like keloid or a little hypertrophic. It becomes noticeable. So that's really not something that I would recommend. I think if you want to do that, the best way to do it is through the Botox and plus minus combination with the fillers.
Okay, can I do filler and Botox at the same time?
Yes.
Please do.
Yeah. Yes, definitely. So you can do both, even whether it's in your lips for both the flip and then the volume, or we can do mid-face fillers. There's a lot of things that we can do with Botox as well. I love Botox. There's many ways to refresh the face and make it look younger and get what you're looking for if you're not ready for fillers. But if you want both, you're gonna get the best results.
Yeah. Have you heard the term baby Botox?
Yes.
What is that?
I think baby Botox is mainly what they refer to when they get like only a little bit of Botox or
Yeah.
preventative Botox
That's
when
right.
they're I mean, I've seen people at 25 start getting Botox, and that's to
Yeah.
prevent these the wrinkles from forming, because you can have static wrinkles versus, so
Yeah, the dynamic ones. So it's true. So I think we do actually recommend starting with the Botox earlier. That's why we kind of love it so much, because if you want to, prevent deeper wrinkles, if you want to kind of have that smooth face for a longer period of time, it's best if you start early. Of course, you're going to start with less units during that time, and therefore you're going to just prevent the aging of the face moving forward. Because remember, once you get to a point where you've had, say, a lot of sun damage, maybe there was smoking and things of that nature, and you get to like the deeper wrinkles, those are the ones that are very, very tough to treat. Even with fillers or Botox, and then you have to go to other things such as laser resurfacing, or better yet, the Morpheus 8. Yeah.
Natalie? Oh, you're on fire. This is
All right. Maybe okay, I'll see you later.
It's if you do Botox or Dysport.
yes, well, we do both. It depends. They're both neurotoxins, and the intention is with the neurotoxin to relax the muscle so that you're not making these expressions. And we can talk a little bit more about that later, but yes, both Dysport and Botox are neurotoxins that we use here at the office.
Okay, this is for you.
Yeah.
Is it normal? Is it normal to be super sore during fluffing stage? Should I try not to see it as much so I don't kill cells?
Yeah, so it's actually not unusual. We've had a few patients that have these kind of sore feelings and things like that after 6 weeks. Typically, when you get into that fluff period, where the cells are kind of hydrating again and fluffing out. It's not too unusual, but what I can tell you is actually don't be afraid. It is okay to go ahead and sit and get back into your normal life, into your normal routines. And it's also okay to go back to the gym and exercise and do squats and things of that nature.
Okay, can Botox or Dysport on neck? That was my question. Okay, she didn't write the last part of the sentence.
Yes, so some people have wrinkles here where the plasma bands are, and we can apply Botox there as well, or Dysport, whichever one you decide.
Okay. Is it I had a tummy tuck, then I got pregnant. Can I just get lipo and a BBL after, or do I require a tummy tuck?
Oh, well, so that's gonna depend on how the pregnancy went, really, okay, and how the skin did during that pregnancy. So if, say, for example, you had to gain a lot of weight during the pregnancy, on top of course, the baby and everything else, that skin may potentially stretch out again, and then you may need a revision to that tummy tuck. So, but sometimes because you've had the tummy tuck before, there's not a lot of excess skin during that time, and the pregnancy is pretty well controlled, then that skin does have an ability to kind of bounce back. In which case, if the skin's doing okay and you didn't develop any muscle separation or any further weakness to the abdominal wall or muscles, then we could potentially do, lipo BBL.
Okay. Can you do this on darker skin? I think she refers to Morpheus.
So the Morpheus, yeah, that's a great question. So
Yes, the Morpheus actually doesn't see skin color, so you can use it. We have ethnic skin, whatever skin color.
yeah, so if you've heard the Fitzpatrick types of skin, which is like 1 through 6, 1 being the absolute lightest, 6 being the darkest, Morpheus 8 works for all Fitzpatrick types. So there's no limitations to that.
This is a TikTok here.
All right, guys, how you doing? Are you sending us likes? Are we getting any dinosaurs?
No, Doc. These people today is asleep here.
Oh no!
Not one dinosaur for Natalie.
At
I
least.
know, I realize.
But the thing is, she has loose skin after lipo and face tight to the chin. 3 months post-op.
Yeah.
Would this get better?
So remember, when we do face tight, body tight, it could take up to 6 months. So what I would tell you is that don't make any sort of final decision right now. Let's give it a little bit more time. You want to wait at least 6 months with the face tight or body tight, depending on which areas we use it for. And then you can make a more kind of objective assessment at that time, and determine whether perhaps something else is needed. Sometimes you can repeat the procedure, sometimes you can actually add the Morpheus. to that without having to go back to the operating room. So it really depends on how things are looking at 6 months post-op.
Guys, remember, non-invasive also causes skin tightening from within. So if you don't want to go back and get another surgery, you can always come see us for the Morpheus.
That's right. Yeah, it's a great alternative.
This says, if I want to have a tummy tuck and a BBL, which one do I have to do first?
So I almost always recommend doing the tummy tuck first, okay? The overwhelming majority of patients, I highly recommend doing that tummy tuck first. Take care of the skin, take care of the abdominal wall, the muscles, right? We wanna bring in that muscle separation, we gotta tighten up that abdominal wall and remove all the excess skin. Do not worry about having enough fat for the BBL later. That's a myth. It's not true. You're definitely going to have enough fat. If you had enough fat before the tummy tuck, you're going to have enough fat after the tummy tuck. Okay? So that's not an issue. Go ahead and get that tummy tuck first, tighten up that skin, and that's going to make the results later of your Lipo360 BBL even better because we can really then contour that body and create that beautiful hourglass shape from the front, upside down heart shape from the back.
So I think this question
Yeah.
looks if I made it because
Okay.
I have it in mind. It's will Morpheus A body reduce contour irregularity from high def basal lipo on abdomen?
Oof. Okay.
got
I
it.
think I think that's really going to depend on how basically the severity of the irregularity. Okay. Because Morpheus 8 does get down to the fat layer, okay, but it's really kind of, to the very kind of top or the superficial fat layer, if you will, okay, because it does go 8 millimeters deep, but that's as far as it goes. It's not going to go any deeper than that. So if it's, something fairly mild, you just want to touch up this very specific area there because it's bothering you, then that's something where it can work. But if it's a little bit more of a severe contour, abnormality, then that's sometimes we need to go back and actually do that more with the liposuction cannulas at that point in time.
Okay, we're almost getting to the end. And Doc, look at this question. Will you do Lipo 360, tummy tuck, BBL in all one session?
No, no. Yeah, we don't recommend that here. So I know you're, next thing's gonna be like, wait, but Dr. X, Y, and Z is doing it. Okay, that's fine. But I don't recommend doing that for a few reasons. Okay, number one, I'm here in Florida. In Florida, we are limited by the Department of Health to only removing 1 liter of fat via liposuction when we do a tummy tuck. Okay, so we're doing a tummy tuck and we can only remove 1 liter. Well, that's not going to be a great result for then a Lipo 360 and a BBL, right? That's as much fat as we should be removing legally, and that's for every single surgeon in Florida. It applies to all surgeons in Florida. Okay, so we really shouldn't be doing that. The next thing is, of course, your recovery. Recovery is going to be extremely tough, right? Because for the tummy tuck, you have to be on your back, you have to be on your buttock basically, and you have to be kind of crunched over because things are really, really tight from the tummy tuck part of it. So you are going to be compromising that fat that we transfer to the buttock and hips. Yes, okay, you can try to do like a mattress with a cutout, you can try to do other things, but you're going to have less than ideal results with that liposuction to BBL. So if you want the best results, the best long-lasting results, then I would definitely recommend separating out those procedures. Do your tummy tuck first, and then come back for your Lipo 360 BBL.
Safety
All right.
first.
That's right.
Safety first.
Exactly. All right. So I think that's it.
Yeah, I think that's
Okay.
it. I mean, other than that, we do have the special that we're running right now for the Morpheus. We're offering 20% off, which normally we only give to our friends and family, but you guys are our friends and family,
That's
friends
right.
and family of Dr. Earl. So,
Yes. So yeah, I mean we're kicking off the Pure Aesthetic Center. So now is the time to come. These are probably going to be the best deals that we'll ever have at the Aesthetic Center, just because we're kicking it off. So pretty much 20% off all or most of the procedures that we're doing, including Morpheus A, Morpheus Body. And also the Botox is only at $10 a unit right now,
Yeah.
which is very, very good for the Botox, the steel.
It's
I
a
should say.
steal.
It's basically a steel. And so we have that going on as well. And on the surgical side, because of Mother's Day, right? We have our Mother's Day promotion, which is 10% off any procedure. Any procedure, whatever you want to do, we get 10% off that. But not only that, but here's the kicker. If you're a new patient, you're coming in, you want your 10% off, but you call us and you book, and you put on your deposit that day, you get another 10% off. All right? So yeah, that's great. We haven't done this in years. Okay, 20% off for any procedure, but it's not forever. This ends Friday.
And there's one more thing.
Friday.
10%. 10% and 50 units of Botox.
50 units. Oh. We want to give that away too?
Yes, sir.
Okay, all right.
I get crazy.
All right.
We
We're
just
going
want you to
crazy.
see how awesome you're gonna look, and then obviously we want to build your trust. We want to see we want to see you guys look and feel your best, and that way you'll stay our patients for life.
That's right. All right, awesome. So on top of all that, 50 units of Botox, free. But it ends tomorrow, Friday, 5 p.m. So call us now. All right, everybody, this has been awesome. Thank you so much for being here with us
Thanks for
on
having
Hump
me.
Day +1. And we look forward to seeing you all next week. All right, take care, everybody.
Bye.
Ciao.